Hi, we are Team Process of Elimination. Our group consists of Victoria, Rachel, myself, Turner, and Alina. So looking at the project improvement we wanted to work on, we mainly focused on healthcare organizations and the bathroom facilities that they provide for their patients and families. So first we defined the scope of the project, which was to first determine the base level at which bathrooms are cleaned within a healthcare setting, and then to identify areas for improvement. Um, like mentioned, the area that we're going to be focusing on is healthcare facility bathrooms and how we can improve those. Primarily, the goal is that by focusing on bathrooms, we're going to be able to help keep our patients, employees, and families happier and healthier, along with hoping to improve the cleanliness of the facility to help reduce bacteria that could be possibly spread overall. We think that cleanliness of the bathroom is a very important aspect to minimize the spread of diseases. Oftentimes, these are facilities that are used extremely heavily, especially in outpatient settings where they're seeing 400 to 500 plus patients a day, all using the same confined space. So looking at the operation strategy, first I wanted to find what operation strategy is. And the definition that I found is it's a plan on how the organization is going to allocate resources in order to support the infrastructure and production. So at least within the healthcare setting that I observed, which was Seattle Children's Hospital main campus, located on Sandpoint Way, we do have a system set into place, environmental services, also known as ES. A lot of healthcare settings do have a system somewhat similar to ES in the fact that they have cleaning routine schedules and train staff members as to ensure that it's done properly to the best of the ability. The main goal, like we mentioned in the last slide, is to understand at what level do they clean these areas and how often. For Seattle Children's, I was able to gather some information regarding their operational strategy and how they go about determining how often they need to provide these services. ES is a service that provides 24/7 for all daily operations, which includes the bathrooms. So here's a couple snapshots of what I took. I do want to focus mainly on the outpatient clinic, which does highlight that these bathrooms are cleaned daily. We'll get onto it later in the slides, but from the observations that I did, there are three main cleanings that happen: one in the morning, one in kind of the mid-afternoon, and then one in the evening. I did find that the one in the evening was done most thoroughly. That and the very morning one, as those were the times that I recorded the bathrooms being the cleanest. Thank you.
A properly cleaned restroom is an extremely important thing within any type of commercial establishment, but especially crucial in hospitals because of the type of people that use them. Typical hospital users are people that are sick and contagious, vulnerable to infections, or people that are regularly in contact with those type of people. That being said, it is important to follow a process that covers every single area of a restroom. This here is a process map that we created to use when cleaning a bathroom. It covers basic things like taking out the garbage to extremely important things like deep cleaning the floor and the toilet with a disinfectant solution. Even with this type of a process map, it can be improved. For example, at the start of a cleaning process, it's important to wear your gloves properly. Without following certain precautions, one can't properly protect their skin from the chemicals used and also the various germs found within the restroom. Another extremely important improvement would be to use color-coded cleaning supplies. For example, using yellow cloths to wipe down mirrors and red cloths to wipe down high-risk areas like toilets and floors. This idea can be used for mops, brushes, and other cleaning supplies as well. The benefit of this improvement would be to lower the rate of cross-contamination. With the prevention of cross-contamination also comes the idea from cleaning from the cleanest area to the dirtiest area. This prevents less bacteria being spread around and getting those cleaner areas actually more dirty. Lastly, it's important to focus on high-touch areas like soap dispensers, toilet flush handles, toilet seats, and also doorknobs. These places are hosts for a multitude of germs, so spending some extra time cleaning those areas would be extremely beneficial. Next up, we have Alina speaking about the reduction of waste.
Everyone, my name is Elena Winfield, and I'm going to be talking about reduction of waste and how our project was able to reduce waste in our healthcare facilities. So like Turner talked about in the beginning of his presentation, our main goal was really to help keep people responsible for cleanliness of bathrooms in healthcare facilities, as well as help try and prevent the spread of diseases. As we all know, going into a healthcare facility, you're usually not feeling your best. So there's a higher risk of spreading bacteria and other diseases, and the bathroom is a great place for all that to fester and to spread. So with that, the three main types of waste that our project focused on was motion waste, time waste, and material waste. In healthcare, there are many different kinds of waste that we might not particularly think about or know about, but these are the three of those many that really stuck with our project. So material waste is what it sounds like. It's waste of any sort of cleaning supplies, rags, paper towels, toilet paper, any material at all that is being wasted. That is going to be when material waste is used. So in our project, we're really trying to eliminate that by keeping people accountable for doing those deep cleans throughout the day. It makes it less likely for them to be wasting cleaning supplies, having to do major cleans throughout the day. So if they skipped their afternoon cleaning and the bathroom was really dirty, they would be called in to do a deeper clean later in the day and use more materials to do that, versus if they just stuck to their routine cleanings to keep the bathroom clean and safe for patients. So motion waste, a little background, is any waste that's wasting basically your energy. So anytime that you're moving that you don't need to be. So the reason that our project is minimizing that is because when people are held accountable and they are responsible for cleaning their bathrooms or the healthcare facility as a whole, even at certain times of the day, there's a routine. And if the routine is out of place, or they forget, or they don't clean as well one time during the day versus another, then they're going to be wasting their energy going back and forth to these bathrooms, cleaning them when patients complain or when staff members complain, versus when they just do the cleans when they're supposed to and do it to their best ability and get it done. Then it'll stay cleaner longer and people will have less of an issue unless there's a major incident in those bathrooms. The last is time waste. So this is pretty self-explanatory, kind of like material waste. Time waste is when you're wasting time of any sort, if that's from running back and forth to bathrooms to taking longer to clean, anything like that. So our project reduces that type of waste due to the fact that, similar to motion waste, when your time is being spent productively doing your deep cleans 3 times a day or what have you, you're not going to be wasting time later in the day going back and forth to those bathrooms when they should have already been clean. You won't have to go and waste your time re-cleaning stalls or wiping down sinks or reapplying or adding more toilet paper or paper towels, because there should be full already from when you cleaned it a few hours ago. So that's the end of how our project is reducing waste. Next, some more of my team members are going to go ahead and talk about some other aspects of our project and how we are helping the healthcare system as a whole. Thank you.
Hi guys. Now that Elena has gone over how our project will reduce waste, we'll be moving on to the final part of our presentation. My name is Rachel and I'll be going over our data and conclusions. For the measurement of our data, we needed to capture 3 key points. The first was a way to measurably rate cleanliness. The second point was to be able to use these ratings as a baseline to track cleanliness improvements. Lastly, we wanted a way to connect the frequency and quality of cleanings to actual cleanliness. With this in mind, we created our measurement criteria. Originally, our scope was too wide. We didn't have enough time or manpower to realistically collect all the data we wanted. Thus, we narrowed our project down to a few measurements. We collected data from 4 healthcare facilities, and each member collected 1 day's worth of data. Elena actually collected 2 days' worth of data for us. Data was collected at 3 points in the day, the beginning, middle, and end of the day. We used a rating scale of 1 to 10 to measure various aspects of cleanliness, and while we would have preferred more objective measurements, this was easy to collect for the whole team, because we understood the scoring system from poor to excellent. Lastly, we collected documentation for quality and frequency of cleanings. On this slide, I have our cleaning schedules compiled, as well as the facilities. Turner collected information from Seattle Children's Hospital. Elena collected information from the Snoqualmie Valley Hospital. Victoria collected information from Madigan Army Medical Center. And I collected information from America's Best Contact Lenses and Eyeglasses, which is an eye care center. I also have the cleaning schedules ranked. To summarize, there was a wide variety of schedules between the facilities. It ranged from once a week for a smaller location to 3 deep cleanings a day. Here I have an example of our raw data. This is a small portion of it. We scored aspects such as overall cleanliness, sinks, floors, soap amounts, toilet paper stocking, and garbage. You can see we collected quite a lot of data points to analyze. Heading into analytics, we found that sorting the information was a bit tricky because there were so many data points. In this case, we used stacked bar graphs for each time of the day. However, a few general trends can be observed. The largest opportunities for improvement between all facilities were paper towels and garbage. Sinks and floors rated decently, and smell and toilet paper had the highest scores. Another analysis we did was on the cleanliness depending on the time of day. A bar chart using the overall total scores made it easy to see which part of the days that cleanliness dipped. I listed the opportunities for each facility to improve on the right. You can see midday it dipped for Turner. Elena was at the start of the day, and both Victoria and I had the end of the day to be the least clean. Lastly, we used a stacked bar chart to rank cleanliness. When compared to how often cleanings were done, there was no strong correlation between the frequency and cleanliness ratings. We concluded that more data would be needed to be collected on usage volume before we could draw any real conclusions from this specific data. Most likely, there was a closer link between the number of cleanings done and the amount of patients using those bathrooms a day. So now we'll be heading into the identification of processes to improve. Overall, our team had a few suggestions for improving sanitation in the healthcare environment in terms of bathrooms. First, we recommend reducing waste by sticking to routine cleanings. Cleaning bathrooms as needed can be wasteful and resource intensive. Secondly, we recommend improving process workflow using checklists for inventory as well as including certain areas to focus on during training, such as high-touch areas and cleaning from cleanest areas to dirtiest. In terms of operations, we recommend to ensure that there are enough people and resources for proper cleanliness improvement. Lastly, data analytics showed us that paper towels and garbage had the most room for improvement. We could also make suggestions on when to focus on cleanings based on the time of day, depending on the facility. In conclusion, we hope our recommendations improve cleanliness scores. If these steps prove effective, we would like to implement them on a larger scale. In conclusion, for our lessons learned, we've learned that process improvement can be tackled from multiple directions. Successful improvement requires defining goals, such as improving cleanliness. Then people and resources should be coordinated according to the pre-existing systems in place, such as environmental services. Processes should be mapped to improve flow and procedure. Waste should be identified and reduced, in our case in terms of motion, time, and waste. Lastly, collecting data allows a team to measure improvements and further analyze how to approach improvement. Thank you for watching our presentation. Our references are included. Thank you.